Hello, it's Dr. Scott McLean, and this is a YouTube video about stress in dentistry, particularly during the COVID-19 viral challenge and what the world's going through. So I thought I'd share some things that I do in my own life and what I talk to my patients about when they come in and they have stress. I was out walking my dog, and I thought this would be a good topic that we could talk about today. So our life is full of many challenges, and of course we have skills to meet that challenge. And this is the secret to happiness, is this kind of flow between the two. Now, before we get into what flow is, let's look at some of the challenges that are kind of coming upon us with our health. We're worried about our health, getting the virus. Our family, we're worried about them too. Staff and office layoffs, financial, news, anxiety. So there's a lot of challenges that have come upon us very quickly with this COVID-19. And so what I'd like to do is kind of do an assessment with a model that I learned about on TED Talks. And I think you should go watch that. TED Talks is fantastic. And I'll give all the credit to them for some of this model that I'm talking about today. Now, there are many skills we can tap into during this crisis. For instance, knowledge with our staff, with other people, with equipment that we buy, with training that we do, with using mentors and getting commitment from other people. But we've got to stay into a routine. So let's kind of look at this flow model. Now, the model that I'm using today on this video comes from Flow, The Secret to Happiness from TED Talks. And it's by Dr. Mihaly, and I'm sorry I can't pronounce the last name. But what he does is relate challenges to skills by taking them and putting them on a graph. So his graph has on the x-axis challenges. And so challenges can go from low challenges to high challenges. And on the y-axis, we have low skills going into high skills. So we start to separate this graph by putting some lines on. We can bring different problems we have and look at how they apply to the model. So we're typically not that happy when we have a low challenge and also a low level of skill. And this means that when we're in this area, we can experience apathy. So it might be that we're doing a simple single amalgam filling or dealing with a small problem and we're just not that into it. As we go up the challenges and we increase the challenge, so maybe we're doing something like an extraction that was difficult a few weeks ago, and we get very worried about that, or something, some financial problem is there, then we might be worried about it. But the problem starts to get worse is when we get a very high challenging situation, like the COVID-19 virus, and we don't have the skill to deal with that. And the skills become a problem because we don't have how are we going to deal with our staff, how are we going to deal with the layoffs, the finances, what's going to happen. So it gives us anxiety and uncertainty. And so this side of the graph is called the red zone graph. And so I call it that because if we stay in this side too long, it can really lead to some negativity. Now, if we increase the skill, but we still stay at a low level of challenge, we're still not going to be in a kind of a happy place. This is kind of a boredom place, and we certainly aren't in a boredom place right now. Might be bored sitting at home. But as we get the skills higher at a low challenge, we become relaxed. And then even more skill would lead us to be kind of in control. And so in this area, we may not be as happy, but we're going to feel in control, and that's always a good feeling. So this little zone, I would call the zone of complacency, and it's what I call the yellow zone. Now, for a lot of us, we're in a zone that we really haven't been in before, this kind of challenging, high challenging zone. And it can create quite a bit of stress for us and that anxiety that we're talking about. So our goal is to try to increase our skills. So learning about the economy more, learning about how we can keep our staff kind of aroused, checking in on them, making sure they're fine. Also making sure you stay connected with your patients. So there's a lot of things we can try to do to kind of stay in this state of arousal, but it's hard to jump from the anxiety mode into arousal when you have this big challenge. And so it's about that skills and looking to your team for skills, and it's so critical to do that. So we have to kind of meet and go over things, look to other dentists, look to mentors, and try to fix this problem so we can start to try to get into that state of arousal. Now, sometimes it takes a bit of work to get into this arousal zone, but some people are natural at doing that, but you have to be doing that and making yourself push forward. So if we can get into the happiness zone, it's in the flow zone, which is a high level of challenge and a high level of skill. Now, I sure would like the COVID-19 to disappear, but it doesn't seem like that's going to happen right now. So we have a lot of challenges that are going to be on our plate. So dealing with those challenges, we want to stay out of the anxiety zone and try to get into that happy zone with the flow. So if I draw a line, we want to stay away from the left. We want to keep on the right. So keep relaxed, keep in control, keep aroused, but get into that flow zone and try to get in there and learn. Like, for instance, you might learn about dentistry now, or you may try to meet with your team, because we want to stay out of this unhappiness zone, because this negative zone is going to be making you feel really nasty. And so if you need help, get help. There's professional help, and I'm certainly not a professional on this topic. I'm just sharing some principles with you, but you can check with your dental association, or you can call a local person to try to help yourself. Now, there are some books that I would recommend that you can read when you're staying at home, because sometimes it's hard to get help right now, but you got to get out of the anxiety mode. I'm going to show you a model that we can use to try to prevent you from feeling too much anxiety. Now, if you do get in this mode, you can have a lot of panic or sleep problems, not being able to stay calm, and feeling cold and sweaty and numb, short of breath. You can get heart palpitations, panic attacks, dry mouth, nausea, tense muscles, and dizziness. So if you're starting to get this, you need to do something about that. So either get some help, you can get some of these books. For example, the Anxiety and Phobia Workbook. This is a great book. I recommend it all the time to my patients. And the other one I'd like to recommend for you is by Dr. Jackie Kinley, The Mental Fitness, The Game Changer. Both available on Amazon. You can get them delivered to your home. So try to protect yourself first with this. If you have a team that's having problems, try to be the leader. Protect yourself first. If you have family, it's like putting on this air. You need to put it on yourself first before you go to put it on your child. So the same thing with this. We need to protect ourselves. Now, another great resource online is also on TED Talks, and I love TED Talks. And you can see this is called rumination, which is turning off work thoughts or turning off thoughts that you have now. So check that out. So a model I like to talk about is something I learned about 20 years ago, and it's called Red CIA 40. And I don't know who the author is, but this is something I use with my patients all the time, and it's something you can use now yourself. So what I'll do is I'll draw one triangle over here and put RED, and I'll draw another triangle on this side where I put CIA. So Red CIA 40. And the 40 means 40 minutes. Now, so what I'm doing with this is I'm using this to be in the green zone. So I'm trying to stay in the green zone, or at least on the right side of that line that we were talking about. So if we look at the first, R stands for relaxation for 40 minutes. So do something where you're either deep breathing, doing meditation, yoga, doing something with your faith or reading or painting, but you need to limit news. Number 2 is E is exercise. So you need to exercise for 40 minutes a day, break sweat exercise. So this is critical. This is really, really critical. So walking the dog, yoga. So try to get your steps in. So elliptical, stairs, bike, whatever it takes. Number 3 is diet. So diet is really critical now. We are going to go to salty foods. We're going to go to sweets. We're going to do all this stuff. So we want to stay low salt, low sugar, low bread, monitor and balance, watch caffeine and alcohol, and increase your veggies and water. So doing so is going to make a difference. Then we also want to have C for catharsis. It means talking to others. So talking to others helps you to vent your emotions because you're discussing how you feel and releasing some problems. Even though we may not correct the problem, it's a good way to kind of understand what's going on. You need to be a listener and also someone that can talk to other people. So you need to find someone you can do that with. The I is very important. It's intelligence. So it's understanding what your body's going through. It's a chemical change in your body. So understanding the adrenaline flow. And so also understanding when you have to stay home. You don't want to be going to work sick. So understanding the body, we're looking at a number of things. So we have to understand that we're going to be worried and feel worried when we are in this kind of adrenaline state. So the adrenaline state comes from the stress hormones through the hypothalamus with CRH, then going into the pituitary gland, and this causes your adrenal glands to grow and respond too quickly. And when this is happening, your body's actually going through a series of worryful events. You're worrying about everything, and so we need to get that back into control with the other things like the exercise, diet, relaxation. And even your immune system can get on a lower level because of this stress response. So we got to get back into balance and control the fight or flight response. That's kind of critical because you don't want too much adrenaline going at a long-term pace. So getting this under control with the Red CIA 40. So last, we have to look at attitude. We need a positive attitude. You need to be very positive for your family, for your team. Also, this is going to end. We're going to get through this. We have to spread love and help and look for the good in people. So this is kind of critical. So be very grateful. Believe that this is going to get better. Get outside one day at a time. This is all going to get better. So do some journaling and spread positivity. So looking at the challenges, we have lots of challenges that we've talked about before, but we have a lot of skills that are going to work for us, and we have to hope that these things are going to start to come soon, like these antivirals and the vaccines, and these are going to be the key to helping us get into balance. So hope this helps you, and I hope you feel okay through this crisis, and we'll all get through this together. This is Dr. Scott McLean. This has been a YouTube presentation.